much. My name is Rhonda Workman. I'm the Director of Federal Programs. And Charlotte, would you like to introduce yourself?
Hello, everyone. My name is Charlotte Whitaker. I am the co-chair of the Waiver Advisory Council, along with Rhonda, and a participant of the waiver that self-directs.
Thank you so much, Charlotte. Karen, could we go to the next slide? And one more slide. Charlotte, would you like to read the agenda, or would you like me to?
Yes, I can absolutely do the agenda. So on the agenda we have today, we will welcome our members, the new members that we have joining. We will go into the approval of December meeting minutes. After that, DDA will be giving us updates. And then after that, we will be going over service delivery and access to service discussions, such as recommendations to the proposed changes, quality enhancement efforts, and improvement discussions. Our work group updates, which will be from the lived experience group and our recommendations group, and then we will open up to public comment. Also, if I could make a statement, there is some very disruptive ambient noise that I am struggling to kind of hear, or myself, or even just focus at all right now.
It sounds like something rolling on a table or something like that.
Yeah, we think it may be the vent. There's some rattle going from the vent. So we'll try to be very clear as we communicate. Is there any way we can, Wes, is there any way we can turn this off or shut it down for a little bit, or turn the temperature so it's not blowing? So we'll see what we can do to address that.
Yeah, because I believe it will cause some serious issues for any of our members who need transcriptions or any other devices in order to listen in.
Okay, we're gonna see what we can do about the noise. Can we go to the next slide? Eric shared this, but just a reminder related to our conduct. We want to make sure, as our group values the free expression of diverse viewpoints, we ask that everyone share their views respectfully and engage with others in good faith. Reminder, disruptive behaviors, abusive language, threats, or harassments will not be tolerated and may result in removal from the meeting. Can you go to the next slide? Charlotte, I'll turn it back over to you.
Yes, thank you, Rhonda. So to go over the ground rules, first and foremost, we have to assume a positive intent, speaking one at a time to allow for respective dialogue, the use of plain language so that everyone can understand, avoiding acronyms when at all possible, sharing information openly, listening to different points of view, staying flexible and open-minded, participating actively, engaging respectfully and politely, and minimizing distractions.
Thank you, Charlotte. Can we go to the next slide, please? Charlotte, I'll turn it back over to you.
All right, the next part of the agenda, we will seek to approve our December meeting minutes, which was the last time the Waiver Advisory Council met. So is there anyone that would like to amend or make any recommendations to last meeting's minutes? If there are no requests for changes or alterations to the minutes, we can move to approve the minutes. And if so, is there someone that would like to vote to amend? I'm sorry, I'm sorry, the noise is very, very distracting. I don't know if anyone can hear all of that.
Yeah, we're able to hear you in the room.
Can we make sure that anyone attending virtual can hear? Because it is very difficult. I just wanted to make sure. before we
Sorry,
move
this is
forward.
Josh. I can barely hear you because of the noise.
Yeah, I think the DDA's, your window keeps lighting up. So I wonder if it would be helped if you could unmute and mute your microphone, Rhonda, when not talking. You know, when Charlotte's talking, you can mute that, and so that might help.
Okay, Marlo noted she logged off and back on again and can hear now, so that's great. Maybe others, if you want to log off and log back on, let's see if that helps. I am turning the mic off when I'm not talking, so we're going to pause for a few minutes, let the members to log off and log back on, and let's see if that helps. I'm going to use this microphone. I'm just going to project to the owl and maybe see if that'll help a little bit too. So we're getting some comments that it's better when people log back on. So that's great. Where we were at was Charlotte had asked for any revisions for the December meeting minutes and then was asking if anybody wanted to make a motion.
And move to approve.
I'll second.
I second as well.
Excellent. Thank you so much. All right, let's go to the next slide, please. So we got a few updates today that we wanted to share, and then we really wanted to get to the larger discussions that we had shared in the PowerPoint to the council members last week. So next slide, please. We had shared with the council some time ago related to the waiver amendment in October 2025 related to the waiver requirements from the federal government to have substitute judgment, a process related to substitute judgment when people have other individuals making decisions about waiver services and providers. In the amendment, we noted that we would establish a substitute judgment form. We've talked with the Waiver Advisory Council. It was recommended that we don't create another form, but to incorporate the information into an existing form. So what we have done with the participants' rights and responsibility document, we have added a new section to the document. It's actually the first part after you get through the first page. On the second page there, it's titled General Rights and Responsibility Decision-Making Authority. We start out with, again, the person understands that they can make their own informed decisions about their goals, services, service models, and service providers. Then it talks a little bit about if an individual has a legal guardian, what does that mean? Specifically noting that as per Maryland law, if you have a legal guardian, you're required to complete training, and that training includes substitute judgment training. The next section talks a little bit about the ability or the right of the person to have other individuals help them in making decisions. And so we talk about that in there, understanding that that support should be done based on the person's preference and interest. And then we further go in to talk about other kinds of team members or individuals that may be involved in some people's lives, such as what we call legally responsible individuals, relatives, and others. And so from those individuals, we talk about, again, making sure that they are supporting the individual, the individual's wishes in terms of helping them to make informed decisions, but not making those decisions for the person. And then we talk about supported decision-making. And that's an opportunity for the individual, if they so choose, to have the team members that are helping them with making those decisions to actually get more information related to supported decision-making. Lastly, we include a variety of resources that are on the form on page 3. It includes links to Disability Rights Maryland related to supported decision-making, the Maryland Developmental Disabilities Council's information on supported decision-making. It includes information related to supported decision-making when you're talking about transitioning youth. It also includes the guardianship part 8 training that's associated with supported decision-making. And we've also included some draft documents for supported decision-making that has been made by advocates. So those are resources that the person at their choice could ask their team members to become more familiar with supported decision-making, and the participant could, at their choice, create a supported decision-making agreement with the individual. So today we're just sharing the update related to that. We want to just let you know that it was incorporated into this document. Today we talked with the CCS leadership. We had a recommendation to maybe add a statement to let people know that they could revoke a supported decision-making agreement anytime. We think that's a great idea, so we'll add that. And then our next steps related to this is we would be sending it out to all stakeholders so that they are aware of it. And the coordinators of community services, we've asked them to review the supported decision-making, this document, the participants' rights and responsibility, that includes the new information on substitute judgment during the next quarterly monitoring visit with the individuals. And then that would be reviewed annually. So we're really excited about being able to move this forward as part of the October amendment. We talked about having this information and put in place in April, so we're moving along pretty good with that. Any questions related to the rights and responsibility form and the update to add the information for the substitute judgment as per the October 2025 amendment? Okay, can we go to the next slide, please? The next update we wanted to share related to the health insurance reporting form. Who's got the hand up? Let's see.
Rhonda, sorry, I'm sorry.
Okay, Laura, go ahead.
I'm a Zoom person, so I'm sorry. It takes me a second to find where all the controls are. Can you just, the substitute judgment with all that, is there any oversight in terms of the completion of it? And if you said it and I missed it, I apologize.
Yeah, great question, Laura. So what we said is we will be sending this out to all stakeholders, and we'll also be sharing that we have asked the coordinators of community services to review the new rights and responsibility document with all participants during the next monitoring and follow-up visit. And then they review rights and responsibilities on an annual basis during the annual plan process. So within a 3.5 month period, we would have everybody having this information shared with them.
But in terms of actual completion of the training that's part of the legal guardianship, is there any oversight of that?
No, we would have no authority over that. To become a legal guardian, it's my understanding the Maryland court requires that training, so that might be something that they require documentation and proof of completing that training. So we don't have any authority over that or information.
Rhonda, if you have a legal guardianship and you have the documents to show your legal guardian, you've been through this. You've had to complete that training. So if they can show you that document, the letter from the court issuing guardianship, they've been through the training.
Yeah, so I don't know if you can hear that, but basically, Stephanie was sharing that to become a legal guardian, you have to complete the training before you get your guardianship paper. So that would be done through the court process.
Got it. Thank you.
Yeah. All right, if we go to the next slide. So in December, we shared some information about a health insurance reporting form. This is specific for people self-directing, and we had a lot of good discussion about that. We received some additional input related to some of the wording, so we've incorporated that. Appreciate to all the members who shared language related to that. So we have here, the links are on the PowerPoint, but we've printed out a copy for those in the room so that you can see that. We have created both an English and a Spanish version of the form. And we have also created vignettes. And so these are just some additional strategies to help individuals to understand the information and others. So it's a mini little video animated that would talk about, hey, did you hear about this new health insurance form? What's it about? So it talks about that. We'll have that in both languages. So our next step related to this is that we would be, again, sending this out via communication for stakeholders so that they would know. This form can be completed by anyone to support the individual that it would come in, so that we can have that information to support us in reviewing and making sure that we are in compliance with the requirements. It is not a form for approval, so we're not approving health insurance. It's for us to get that information. And as you may remember, in December, Robert mentioned doing an environmental scan of really that information. So this is just a follow-up related to that. Yes.
So while we're on health benefits, in the manual, there's some changes to that section. And just wanted to know if we could have more clarity on, I'm a support broker, and so I've had individuals that have been reimbursed for a couple of years. And then in the past 6 months, with some of the changes that have come with the manual, they've gotten denied by the FMCS, saying that they're no longer allowed to cover vision, dental, and prescription. But nowhere in any of the documentation does it specifically state, and in the edits that have been made to the manual, it doesn't say, does not cover prescription, dental, vision. So is that allowable? If not, can we make it very clear? And can we also have a discussion about why that is? Because it's almost impossible to even find policies that don't cover it because it's standard. And I've sent data to you and Christy about that. Like, it's very standard across the country for small businesses to offer those things.
So we will talk about the manual in a minute. So let's just finish up. Is there any comments or discussions related to the next steps for the health insurance form?
So this is just because I don't know. Files to be uploaded, last month's premium bill. So I'm bills actually received each month.
So so this is a reimbursable. This is not something they're paid for in advance. So they have to pay it.
Yeah.
And then we have to upload a copy of their bank statement showing that it's been paid, a receipt from the company, their policy.
And then the actual premium bill.
Yes.
Okay.
And all of it has to meet the FMCS guidelines, which sometimes is like, you can't get Blue Cross Blue Shield to produce what is being required. Right. So it's now taking, I have people that are 6 months in the hole on a health benefit that they're not covered. Okay, it used to be covered and now it's not, so.
Matt.
The employee costs to be reimbursed part, you might want to put some sample calculations in there, because we've run into trouble with, like, it's easier for the primary, if the primary employee is the primary holder of the policy or insured personal policy, that that's easy, but if you get into dependents and stuff like that, the calculations get complicated and people aren't really gonna know how to do that, so you might wanna give examples or something like that.
In the form?
In the form, yeah, sorry, just the part that says employee costs to be reimbursed, that.
Okay, examples in the form for employee costs. Okay, yep, thank you. Okay, thank you for that. Can we go to the next slide? So the next slide is related to the self-directed service manual. So we did share information about the manual, some updates related to that. For the manual that we sent out, just a note on page 2, we've got this new kind of format to kind of help people that really gives you an update to the manual. It'll let you know the different updates that are being made. So as we show on this slide, there's some updates to employee benefits, waiver services, reimbursement, goods and services, and relatives legally responsible individuals and legal guardians. We saw a couple tweaks that we needed to align with the waiver and also some additional clarification. For the health insurance, we were providing that kind of glide path, that transition, and so we're noting that really individuals that may have been reimbursed in things that were not in line with the policy or the manual, we provided that glide path, asking that that would be updated during their next annual plan, at least by July. And if not the case, if you had to do it in open enrollment before next January. So we're trying to provide that glide path related to that. We put this, the manual out, just wanted to let the council members know we're interested in your input in that. We designated that web page for that. We know that we just shared that with you last week and you probably want more time to look at it and discuss that. But this was just to acknowledge that and to let you know about the new summary for that. We look forward to your input related to the SDS manual. Andy.
I didn't hear this, so I apologize. I'm trying to listen really carefully. Can you just explain the changes that were made to self-directed services, people that in their IFDGS through the cost containment decisions made last year in the Maryland General Assembly, and also data administrators. So did you say, are there still people that haven't experienced an adjustment because they haven't had their annual plan yet, and they that will be they'll see those adjustments, as late as July if their plan doesn't fall until July?
Yeah, great question, Andy. What I was saying was really, I was talking about the health insurance kind of transition timeframe, but as what you're talking about, yes, there were changes made related to the amendment to include day-to-day administrator and other things for goods and services. And to provide flexibility related to that, we said that individuals were authorized those services prior to the amendment could continue to have those services through the end of their plan year. So yes, those plans as they're coming up would need to be in line with the policy and the manual. So those plans would be coming new and a number of them in July. So yes.
Okay, thank you.
All right, and can we go to the next slide? And lastly, before we go into some of the broader discussion that from the council member submission, we just wanted to let you know that, DDA had conducted a community meeting related to sustainability for fiscal year 2027. We know that there's a lot of discussions going on and has been shared both with the deputy secretary and others within the department, open to information and ideals. So once those decisions are made, we are ready to do any amendments that may be needed. And just to let you know, as per the federal requirements, we would do our public input process, and then it would go to the Center for Medicare and Medicaid Services. So just letting you know that from terms of the waiver services or waiver design, we're on the ready to do the amendment once we get the final decisions. Related to that, we did receive an email from the waiver recommendation subgroup that included a number of topics that related to the proposed sustainability. And so what we'd like to do now is go through each of those recommendations and then open up for the council for discussion related to that. So if we can go to the next slide. So we put this all under our service delivery and access to service. It seemed like all the information and the topics was related to that. We go to the next slide. The first item that we received in that email listing from the waiver recommendation subgroup related to person-centered plan authorization timelines. We go to the next slide. Specifically noted in the email, so this was the recommendation from the subcommittee. It noted that the extensive timeliness currently experienced by coordinators of community services, individuals who are self-directing, and providers has resulted in the necessity of requesting a full year of authorization. This is due to the person-centered plan process becoming overly burdensome and time-consuming. Consequently, mid-year amendments to plans are viewed as both realistic and practical. Next slide, please. The waiver work group recommends procedural changes to the person-centered plan approval process as a way to reduce over-authorization, including allowing only one clarification cycle. This applies not only for the approximate 800 individuals with budgets exceeding 500,000 that do not use their full authorization, but also for those with budgets under 500,000. Next slide, please. The waiver work group is requesting DDA track the full timeline for initial PCP submissions to final approval rather than simply measuring each step separately, as the process may include up to 3 clarification requests and responses. Total review time can exceed 135 business days if a plan remains unapproved after the 3 clarifications. A request to start a whole new plan can be made by DDA. So now, again, these are recommendations that were made from the waiver recommendation work group. So we're bringing that to the full committee. So the full committee can discuss. And if the full committee would like to make a formal recommendation to DDA, that could be framed and voted on and then shared with DDA. So we'll open it up now for discussion with the full committee. If there's specific questions related to these recommendations, we would defer to the subcommittee, Charlotte, Karen Lee, or others that are on the committee to provide additional information related to that. So I know we have Andy, and then I saw you, Stephanie.
Thanks. I have notes from Karen. Karen couldn't be here, so she asked me to work with Charlotte to, answer questions. But one thing I wanted to say was when we talked about simplifying the clarification process, I don't recall us as a group considering that it should just be one clarification request. I recall us talking about there should be we should try to get to just one if possible. And instead of, because right now what happens, someone will get a clarification request. It might be for one issue with the PCP. They provide the information related to that clarification request, send it back to DDA. Then they'll get another clarification request, and it might be for that same issue, or lots of times it's for a separate issue. And so that's how you can get 3 clarification requests, but they may not even be related. So what we were hoping to accomplish is some kind of a format for these clarification requests where the whole plan is looked at. Any clarifications that need to be made are all put on that clarification request with the intention to get to one clarification request. I just want to make sure we weren't inadvertently limiting people to having a plan denial if they didn't satisfy one clarification request.
Yeah, thank you, Andy. And we just copied exactly what was submitted to us in the email. So thank you for sharing your perspective on that. Any other thoughts or discussions related to person-centered plan authorization timeline? We had Stephanie who was next.
I was going to say the exact same thing as a group. I don't believe that we said only allowing one. It was please bring back all the issues that you have with the PCP at one time. So I think maybe the wording that there got a little, but it was why, because it almost seems sometimes like a pattern of extending it longer. Especially for people, I find it also during the revision process. I had somebody start a revision in October, and now they're being told they have to wait for their annual because they're too close to the date. And each time it's come back with a different clarification, which seems, why did they come back with those other 2 clarifications at the beginning? So I think that's, as a group, what we were all talking about was that bring everything you find first time, but not limiting it to, oh, you've had your one clarification, so now we're gonna deny your plan, or, because that should, yeah.
So I guess I wasn't at that subcommittee meeting too, but I fully support the idea. I guess my question is, why are separate clarification requests sent? And why isn't it all done in one?
Yeah, I think that's a great question. From my perspective, in talking with our regional offices, the plan reviewers will do a comprehensive review of the person-centered plan. They will send out the clarification requests for things they see in the plan. Often what happens is when the plan comes back, that item may have been addressed or what we had saw initially, but there's other changes within the plan that were not requested. When that happens, we have to review that, which could trigger another clarification. So all the regional offices are directed to do a comprehensive review and submit clarification requests all at once, because we don't want to do one-offs and come back. That was something that maybe had happened in the past, so there is a very focused effort to get them all. But what we're finding is when we do that, it opens up the plan and other things are changing. And when you change other things, then we have to look at those other things that may trigger additional information or clarification to justify whatever the change or the assessed request is.
So I'm hearing you say the workflow process is that they look at it comprehensively and at one time send all clarifications that might be needed at that time. But it's when you get it back, there might be like, oh, I see something differently now. What does that mean? And they're sending another one.
Yeah, and we're happy to, take some of these concerns back to our plan reviewers and, reinforce that. But yeah, that is our process, that a full comprehensive review would be done. All clarifications submitted are sent at once, because it is our goal to decision that plan as soon as possible.
Is there a way to see in LCSS like track changes with dates? Because in my small population of individuals that I see, that's not been, like there have not been changes, yet it comes back with a second or third clarification. And none of those, that's exactly how it was submitted originally. So maybe if there were some way to see like track changes, it would also help the reviewer to see, oh, they made some changes here. I don't know if that's a possibility in the system, but it might be helpful.
Yeah, we can take that back. Yeah, we can take that back and explore it.
Two hands raised in a comment. Marlo.
Okay, Marlo, please.
Hi, thank you. I appreciate Andy and this subcommittee, this particular recommendation, because from the family's perspective, I think this is where some frustration comes in. They feel like they've sent in all of the information and then clarification is needed, and then another clarification is needed. So I think that either having a checklist might also help, but definitely this timeline I think will help parents and families because of the fact that it seems like it's taking longer and then more information is requested. So sometimes they might be feeling like, why didn't you ask for this information in the beginning?
Thank you.
It was Ashley doing a bunch.
Okay. Great. All right. Anything else? Oh, is that Josh? Josh, did you want to share a comment? Okay, we'll go to Emily.
Yes, I already put my comment in the chat though.
Okay, great. And we're taking input right now from council members. Okay.
Charlotte.
Teresa?
Charlotte.
Go ahead, Charlotte.
Yes, hopefully it is in line kind of with what we're seeing, but I think what we have discussed a lot in the lived experience group is in terms of these kind of issues that we are forced to kind of go back and forth with DDA, we see the excessive kind of administrative needs and costs that come with that. So we'd like to push towards moving towards systems that can reduce those types of administrative costs, the service errors that the participants end up, burdening the consequences of, with things like this. It's a very common thing across the board. And I think looking at those needs to be a priority.
Thank you. Teresa. So I have a question on the third one. So for the record, can you explain what timeliness data you do track? And is it actually indeed measured separately? And do you look at from end to end?
Yeah, Nova, I may ask your help with this question. We're talking about person-centered plans and what data we actually track. From my understanding, we track person-centered plans. We know their due dates. They need to be submitted 20 days prior. So we are looking at that. We have data related to when it's submitted to us. We also track when we decision those plans. And so we're looking at that. The process really is with the clarification request. We're looking for a response within 5 days. And so if we can get those responses in, then those clarification, up to 3 clarifications could be conducted within that 20-day period. Sometimes it takes longer. We know that coordinators have to reach out to individuals and families, potentially providers, to get things that are missing from that perspective. But we do track when they're coming, if they're late, submitted late to us, and our process in terms of our review. Nova, did you want to add anything else related to what we track? Okay.
And then what is then, again, so there's common understanding, what is the timeline then for the DDA team, the reviewers, when, assuming there are no clarifications needed, that time they get it to time that's approved, what does that expect that time frame?
20 days. It's often done prior to that. Yeah, it just depends on the plan and
then does DDA internally monitor that of their staff?
Yes. We monitor that. We will also pull reports daily. So if a plan is due tomorrow, the annual plan date is tomorrow, and it just gets submitted to us today, the regional office will prioritize that to try to get the review and approval so it doesn't go into auto extend. That's why it's so critical that we get the plans 20 days before so that we don't have to go into an immediate crisis mode to review those before they go to auto extend. But regions pull reports daily to see the status of that, and then they assign staff on the individual levels to prioritize those.
Thank you.
And so if there's a clarification, what is the timeline on the response from that clarification? And then does that 20 days start over again?
No, the 20 days doesn't start over again. As soon as we get the response back, we want to decision the plan as soon as possible. Again, as I said, our process and standard is to decision the plan within 20 days, including any clarification back and forth.
And then my final question is, if we're finding that this does not tend to be the case, then what would be your recommendation for follow-up on that?
Personally, I think it's really important for all members of the team to support the person-centered planning process. Mm-hmm. We have put out guidance in the past related to really roles and responsibilities, because each individual on that team, including the participant, has a role in that. We asked the coordinators of community services to help facilitate that, but really it's a team effort. So it involves nurses, if there's an HRST or a health risk screening tool that has to be done for a reviewer, 3 or above. Providers, if a service implementation plan is missing or other documentation to support the need. Participants in terms of making choices of providers or other supporting documentation. So it really is everyone. So it's really important that from the beginning, that during that pre-planning process, which usually starts 90 days before, that a lot of that work and review is done so that when the submission of the plan, we get a quality plan. We also recommend that from the coordinators of community services agency that a quality review would be done before it gets submitted. That helps to identify some of those gaps or issues, discrepancies that we have seen. And as you know, we meet with coordinators of community services to talk about those things. So really, it's really important for all of us to work together to ensure we get a quality plan from the get-go, because then we can decision it quickly within those 20-day periods. And just, we can, wanted to share this with you. There are a number of recommendations from the team and related to program sustainability. And since this is a really critical time with the budget process, just wanted to let you know, I'm here, I can stay all day, but if we're gonna get to some of those other topics, we might wanna consider, cutting off at some point and moving to the next one, but we're open to whatever the council would like to do. So we have some hands, we got that.
Yes, thank you. I have 2 questions. One question, and I apologize if this has already been answered. Did you say that DDA tracks what clarifications are requested so that DDA knows where the CCSs are kind of struggling to send in a good plan, to send in a complete plan? Tracking that would allow us to see where additional training might be needed, since ultimately the CCS is responsible for what gets submitted. That's one question. And then the other is it possible to just add a requirement that the CCS certifies that no other changes to the plan were made when they put a clarification in? Just a box to say, like, this is the only thing that we've changed, I certify that, or something as simple as that.
So for your first question, yes, we track clarification so we can trend them and follow up with the agencies as applicable. We are responsible as the operating agency to review the plan, so we would want to make sure we do that thorough review. We appreciate your suggestion and we'll take that back. We have Josh.
Thank you, Wanda. So I have a question. So it says here that if a plan remains unapproved after 3 clarifications or requests to start a new plan can be made by DDA. Is that definite? So let's say that there's a 4th request made. Does that automatically mean that a new plan must be made, or is that? Does that make sense, Rhonda?
I'm trying to understand, Josh. A couple of things I would say is, again, this information that we have on the screen was shared by the waiver recommendation work group. DDA will do up to 3 clarification requests before we'll decision a plan, and our guidelines are to do that within a 20-day period.
Okay, I get it now. Thank you, Wanda.
Great. All right, we're going to take Andy, and then we'll see if there's any formal recommendation from the council before we move to the other one, if that's okay with the members. Andy? Andy, you're muted.
I don't know why. Okay. I wanted to say that we also talked in this subcommittee about how the 5-day turnaround for families can be probably for providers too, because often it's asking someone to get additional documentation from a doctor or something like that. And so if possible, if that timeline could be looked at and the response time be looked at, that would be helpful. I don't know why I didn't make it into the notes, so I'm adding it now. And the other thing is there's this sense that DDA resets the timeline clock at the point they get it, and the response back from DDA it feels like it takes longer, and so this process can really drag out. That's how I think we got to like 135 days, and then the plan goes into auto extend. So could we see a visual on the prescribed time frames, and is DDA tracking it from the moment they get it the first time to the moment it's resolved, and the time in between for on both sides, people and DDA, the response times?
Yes, we are tracking that information. Yes, we can create a visual. Any formal recommendations from the council on this topic?
Rhonda, did you get that? I'm making a recommendation on the council that we look at the timeline for response for the family and provider and maybe extend it beyond 5 days.
Okay, so we got a motion on the floor to look at the time frame and extend it beyond 5 days. Okay, second discussion. Any amendments? Charlotte?
Oh, sorry, I'm lowering my hand.
Okay, all those in favor?
Aye.
Aye. Any opposed? So Andy, can you repeat it one more time so we can make sure we note it specifically?
When a clarification request is made of a team that, I don't know what to request, maybe 10 days instead of 5 days, but 5 days is too short. So what does everyone think about something like 10 days?
So I think Emma, or Andy, what you had suggested was to extend the time frame. Do you want to get specific in the days? Does the waiver work group want to take it back and discuss a little bit more, come back with a formal details? I just know we have some things to go through and I don't want to, I think we could use our time wisely talking about some of the other topics unless you'd like to discuss and debate 10 days, 5 days, 15 days.
Charlotte, are you okay with us taking this back to the work group and come up with a specific recommendation?
Absolutely, absolutely. I think that's a good idea.
Okay, so just to be clear, now I'm hearing that the motion is not going to go forward. It's going to go back to the work group to come back with a little bit more details. Is that correct, Andy?
That's correct.
Okay.
Thank you.
That's a quick question. Is 5 days the goal, or is it if it goes past 5 days, the plan gets denied? Because I feel like sometimes it just drags out. I mean, would that be the goal? But
The 5 days is the guidelines that we're
so it gets denied.
I didn't say that. I said that's what we're looking at. So we try to support the plans to get them decision as soon as possible. So again, I think that the thing that we talked about initially, if we can do good pre-planning from 90 days forward and every team member plays their role, I think we wouldn't be having some of these challenges at the end. But yes, our process has noted, and I think it's in our person-centered plan manual, talks about the process. 20 days before should be submitted. We have an information sheet on person-centered plans that will do up to 3 clarification requests, and the process has been 5 days for that information to come back. We do a lot of follow-up with CCSs and ask for that information. And again, I know they're working with other team members, so it's not an automatic denial after 5 days.
I don't know that if we need a new standard, if it's not that it's an automatic denial, if there's an extenuating circumstance that they can convey that and say, I need to talk to a doctor or whatever. I'm having trouble getting documentation. It's not like it's going to be denied and have to start it.
Yeah, it sounds like great discussion for the waiver recommendation work group, so you guys can formalize. Yep. All right, let's go to the next topic. If you go to the next slide. The next topic related to automatic approval for unchanged plans. If you go to the next slide, please. The specific recommendation wrote to reduce workload for reviewers, we recommend implementing an automatic approval process for person-centered plans that have no changes from the prior year. So opening it up for discussion for the council member and then any formal recommendation.
I have one question as it relates to this. I wasn't at this meeting, but what situation would a PCP go from 1 year to the next and go unchanged in any way, shape, or form? I guess it's
like if someone just has day services and they're going to have the same services. If there's no,
so it's just the service authorization piece?
Right, it's a DSA doesn't.
Okay, that I would agree with. I think we probably need to be more specific within the wording there.
Right.
Should it also be like the assessment needs have not changed? Right?
Yeah,
Like
I mean,
they should go together, so. If somebody's assessment is lower, then they wouldn't need as much service or vice versa, so.
Right, so I'm hearing in the room, there was a comment that we should clarify. There should be a clarification if we're talking specifically about service authorization. Then Stephanie's talking about there needs to be a determination. I think you're saying whether the assessed need was higher or lower should be also be considered. Is that what you're saying?
Yeah, I'm just wondering if like somebody's HRST score goes way up, then, or goes way down, then.
Should that impact service authorization?
Right, exactly. Should there be a look at that? I agree with the concept of there have been no changes, yes, move it through. But it seems to me that maybe it should trigger a question mark there if there's been a major change in say, their assessment.
Okay, we have Emily's hand up.
Yes, can you please address my the comments I have in the chat?
Emily, if you could just go ahead and read them, that would be great. There are a number of people from the public putting comments in the chat. I was searching, I was not able to find your name quickly. So feel free, go ahead, you have the mic. Go ahead and share your question.
I'll just read it. Okay, so the first one is the clarification process takes a very long time and affects self-directed services in the budget. And the people that I have on staff are not paid during this time. The second question is, I recommend the visuals to be seen about the PCP submission goes through it, the process. I would like to see the steps on the PCP process the way that I can understand what happens when I submit the PCP. And then I would also like to see pictures. For me, it's better to read when I see it's too many words on too many different pages.
Great, thank you for sharing that, Emily. That's very helpful.
You're welcome.
All right, anything else on this topic? Any formal recommendations?
I would also agree that I recommend or agree with the workload to reduce for to reviewers that we recommend for the automatic approval. So those are my.
Are you making a motion, Emily? And could you restate it?
So I said that I would agree, or I would motion that to reduce the workload for reviewers, we recommend implementing an automatic approval process for PCPs that have no changes from the prior year. So
Okay.
I do agree with that.
Okay, you agree with that?
Yes.
Okay. She moved. She made a motion. You made a motion, okay? Yeah. So that's second, okay?
I say,
All
I
those,
second that.
okay, we got 2 seconds. Any discussion? Okay, all those in favor? Those opposed? People not voting?
So I agree with this in theory and in principle, but I think it needs more to it before I can vote for it. I think we need to clarify the piece around the service authorization being what is automatically approved. Additionally, I could see running into a variety of issues from the department's standpoint for somebody who has a higher level needed plan and it has a higher budget, for example. And so the justification for those, but I think that we would run into issues if a person's at or exceeding if there's a cap in place. I could see the department having issues unless we have everything in line. I'm not sure that this one is ready for full recommendation yet, from my standpoint.
Can the waiver subcommittee people that participated and made the recommendation provide more clarification?
I mean, it makes a lot of sense because it could streamline a lot of unnecessary workflow. The problem is that it's a little too generalized right now. I'd love to also hear from the department standpoint if it's even viable. I feel like some of these recommendations that we bring up, we don't get a lot of viability for those recommendations from the department, and then they're feasible recommendations and reasonable for us to even be recommended. And so I think some more conversation around that may be helpful.
Yeah, I would say from the department's perspective, IT can do amazing things. So we can always explore that. The timeline, the costs associated with that was a whole nother story. And once we get formal recommendations, we're happy to further explore that and the deputy secretary to consider all the information related to any recommendations that would come from the Waiver Advisory Council. So we had a motion, I think that was second, and a number of people I saw agreed. I thought a number of people didn't vote, and then we've got another suggestion to maybe work on it a little bit more. Did I get that correct?
Yeah, we have a couple more hands up here.
Okay. Let's go to Jamie.
Yeah, thanks, Rhonda. I agree with Rob. I think that this needs a little bit further conversation. And I'll just say, I know Teresa, you're in the room, but the PCP timeline and the complicated work that happens around approvals and authorization has been ongoing conversations that the CCS community has also had. So I think that I would recommend that it goes back to the subcommittee, but also that the DDA engage with the CCS leadership group that they formed around recommendations for the PCP timeline specifically.
So I support Jamie's thinking, but my question is, this came from the waiver subcommittee. And so those that were on the waiver subcommittee that made this recommendation, are they able to expand on their thinking around the recommendation?
We have Andy and then Charlotte.
Regarding this recommendation, I think what we talked about at the subcommittee meeting was simplifying where we could. So where things were unchanged, can we just check boxes, things like that? But also the nature of our service system is that people do change. We want people to continuously evolve, right? We all want to evolve. So I don't know how realistic it is that someone would have a completely unchanged plan. And so I do hope we take this back. I want to change my vote to a thumbs down instead of a no vote, if that's possible. And I'm hoping, Charlotte, I see your hand up next. I'm hoping you can expand on what we did talk about at the meeting, because I think these are simplified. I think we had a note taker that simplified some of the concepts we reviewed, and yeah.
Thank you, Andy. Charlotte.
Hi, yes, this is Charlotte. So, I mean, I guess the first thing I would like to bring up is what are the downsides to this? Because as someone who experiences this firsthand, if there are no changes and there is no need to review it, it will help with the workload that people have or that administration has to keep up with this yearly requirement. And so what I'm saying is, what are the downsides to not requiring work for unchanged PCPs? And on top of that, wasn't this a practice that DDA had before, where there was an auto approval? And if that was the practice before, why did they stop? What were the changes?
Yeah, from a federal programs perspective, we are responsible for reviewing and authorizing services. And so from that perspective, we feel that's our responsibility to do a review, a comprehensive review of the plans, to confirm, assess needs. As Andy said, as a state, we want to support people in a variety of areas. We are an employment first state. We want to see the use of technology. We want to see more independence, self-determination. And so we would want to see those changes not only in outcomes, but also needs. Some people's needs are gonna change. We have people aging, we've got people living longer, all this great technology and things going on, and people are changing what they wanna do in terms of jobs or community integration. So we would anticipate and be looking for changes in all those areas. But as the operating state agency, we are responsible to review person-centered plans to confirm assessed needs. And that is ultimately reviewed by our Medicaid and then also by CMS. So that's why we feel it's our responsibility to review. Matt.
Okay, so, okay.
I
But
think
it
that
is.
was answer to Rob's question earlier, though. I mean, you answered sort of like technically LTSS could probably do it, but I think that the answer, I think what he was getting at is it even feasible? Like, would Medicaid be okay with that? And it sounds like, you know, DA needs to review that plan and give a like positive affirmation rather than essentially putting them all on auto. That is the role that DA has. Correct, is what you just said.
It is our responsibility, yes.
I think we saw and attempted this over the past couple of years. There were times where CCSs were putting in the notes section, like, this has not changed, right? Whatever the service was in the chart, and they would put it like next to it, service has not changed, same as last year. So whatever, you know, and those plans where they kind of identified no change in service did seem to go through a lot faster. So maybe there's like a way that there's almost like when you submit a PCP, there's a questionnaire that says, you know, have services changed, just to kind of like streamline that process. You know, no increase in any services, no, and then maybe there's some way to use technology, like you were saying, to kind of look at that would make it go through, that would just quicken the process.
So I think, just again, in interest of time, because we have some other things to do, we can continue to discuss this. I think we heard a couple of motions. I've heard some counter motions for it to go back to the committee, seems to be where we were landing. So just to confirm, I'm going to ask committee members to give me the thumbs up or thumbs down or your hands up for the recommendation for this to go back to the waiver recommendation work group to have further discussion and in detail. Okay, those online. Great. So we look forward to additional information from that. We're happy to join the work group to have discussions. Okay, if we go to the next topic, please. Go to another slide. So this one is a recommendation related to meaningful day service definition consolidation. We go to the next one, please. The specific recommendation that we received noted consolidating some meaningful day service definitions to increase flexibility and reduce administrative burden. The current level of rigidity requires individuals and teams to request more services than they will likely use because of who the pieces of the multiple services fit together. While we understand the complexity of administering fee-for-service structure varies daily rates, we believe that some consolidation would impose flexibility and reduce unnecessary over-authorization. So open it up to the council. Yeah, Rob.
Yeah, I think I actually really like, as a meaningful day service provider, I really like this recommendation. I think particularly as we're looking at the possibility of capped waivers, right now what I see in a lot of PCP service authorizations is a request for rehabilitation and also CDS. And so that takes a budget almost to a place where it's never going to get to. And right now we see with rehabilitation groups this ability to have two services within one service definition, just at a different rate. And I think if we can look at how that is structured and try to apply that across the board, maybe then we don't have to worry about having these huge budgets that are never going to get spent.
Yes, thank you. Any other comments or discussions?
I think for employment services as well, I know that because there are limitations on the amount of job development a person can get in a given year, I do think that looking at the ability for those service definitions to collapse back down could also help, because that's another area where you get over authorization in places. And so it could help with bringing those budget numbers down.
And so for this specific item, it's something that we've been kind of thinking about for some time about how we could be more flexible, because as you know, right now, the waiver notes that you can get up to 40 hours of meaningful day services. What's happening is there is over authorization as we're trying to provide the flexibility to people to easily access those services without having to do a revised plan. So we have been discussing internally and working with our LTSS team members to do something similar to what we did with day habilitation. Under day habilitation, we used to have day have small group and day have large group, but really people were making decisions during the day, and so we collapsed that under day have. So some of the framework that we're thinking about would be a meaningful day service bucket that basically would be the 15-minute services. So it would be your CDS, your day have, your ongoing job supports, any 15-minute service would be underneath that. And individuals in our mind, as we're kind of visioning this, the coordinator would go through, and if Rhonda needs employment services ongoing and does CDS and maybe day, those would be checked. Providers can still be identified, but the bucket overall would be 40 hours limited, which is what we have on the provider portal side. So even though we're over authorizing on the plan side, it's limited on the provider portal side. So that's something that we're looking at and working on, and we'll share some updates soon, but it's something that we think from a technology solution we'll be able to do similar to DayHab that will then help to address some of those concerns with over authorization, but provide the flexibility of that 40-hour meaningful day bucket for people to be able to access that. That being said, we're really looking at this for the community providers model, community provider managed model, because the ability within provider portal to limit the billing from that perspective, right? For the self-directed side, we would continue to support individuals in terms of authorizing their actual services that they need. As per the person-centered plan manual, we do not over-authorize self-directed budgets because we are giving them a budget from that perspective. And we don't have a way to control the billing on the FMCS side related to that. So we would continue for the self-directed side to authorize the specific services that people have, and then look to continue to have that flexibility on the budget sheet for them to kind of move that money around, because they can do that currently today with those kind of 15-minute services. So we would do something similar, just it would be in the budget sheet for meaningful day services for people self-directing, and in the PCP for provider managed. Great. Let's go to the next topic. So the next topic is service authorization process improvement. Can you go to the next slide, please? The recommendation from the work group was to reduce repeated clarification cycles and inconsistent decision-making across regions. We recommend that DDA review which services that most often get put into clarification process and develop the clear written guidance on those services, as well as dedicated hours, enhanced services, and justification requirements. Next slide, please. We also request that this guidance for what is approved and what has required clarification be standardized statewide. Additionally, we recommend DDA create a checklist of what should be included in each service to support coordinators of community services, providers, self-directed participants, while strengthening inter-rater reliability among DDA reviewers across the state. I think we've had some of this discussion, and I think a few members had kind of brought up this related to a checklist, clarification items from that perspective, but just opening up for discussion with the council.
I think, creating more objectivity within the review process is good, and standardizing that across the state. I think the experience is often that what might get approved in one region doesn't get approved in another, or vice versa. And so to whatever sort of, what we call it, inter-rater reliability, any way we can grow that would be beneficial.
Along with this, I know it was in the SP Act of 22 where participants were supposed to have access to at least view-only access to LTSS. And one of the things that is not consistent is individuals actually seeing the actual clarification. They might get it reworded by the CCS, or sometimes the CCS is responding to the clarification without even notifying the individual, and that it should be a team decision on how that response is made. to the clarification, so I meant to bring that up earlier when we were talking about clarifications. But I think that also kind of falls into here with, just more transparency on those clarifications, better communication with the whole team. I think needs to happen.
Yeah, and I think that's something that we can definitely talk with the CCS leadership related to that process. Any other discussion? Jamie?
Yeah, thanks, Rhonda. I would also just say, in addition to the conversation you want to have with CCSs, conversation with the regional offices, ensuring that they don't instruct CCSs to remove components of the plan and are very specific to say that it needs to go back to the team.
Okay.
So I guess, again, I wasn't at this meeting, this happened, but when I read this, I understand, I totally agree that as much as it can be golden when we submit the plan, right, everything in place, right? What I'm getting a sense from here is that there's inconsistency among reviewers and the regional offices. And so I think the ask is, what can DDA do about that? Is it related to training, just like, on CCS end, but what can DDA do to increase greater reliability among the reviewers? That's how I interpret this.
Sure, we do ongoing training, just as CCS do ongoing training, and I'm sure providers too. So we're happy to take this back and continue to work with our plan reviewers. They do meet as a team together and have that training and discussion, so we're happy to take that back. Andy.
I just wanted to second what Jamie said about, and I don't know if it needs a motion or just guidance for DDA to make sure regional offices are not telling teams to remove services that the team has already determined the person needs, and that if there's documentation required, that there's clear guidance. And it could just be examples of what's been provided in the past, because we want to have some flexibility there with the teams to decide what's the appropriate documentation to provide for a given service, but having examples would be really helpful.
Yeah, thank you for that. As one of the program sustainability proposals from the governor's budget was to do advanced training for everybody related to dedicated hours. And so I think that's a great opportunity for us to, again, share with all team members, all stakeholders related to standards related to assess need and documentation. So something as we go through the process and things get more formalized and finalized for those decisions, we'll be sharing some additional information. We did update the service authorization provider billing guidance related to the October amendment. So you'll see information in there, and also the person-centered plan manual. So you might want to take a look at that. We did clarify in there when you're asking for dedicated hours, some of the supporting documentation, that it's important that we need more details. It's more than just someone writing, Rhonda needs one-to-one, but for what purpose, for what needs, when, what are the qualifications and training of the people that are going to be providing that. So when you get a chance, take a look at that, as we're sharing some additional information that may help with the process. So we appreciate some of these suggestions. We'll take them back, and then if the council wants to make any formal recommendations to the DDA, we're happy to consider that as the motions kind of go forward, or if the group wants to work on it more in the waiver work group. Okay, let's go to the next one. The next topic is transition into annual maximum amount of service allocation. Can you have the next slide, please? Waiver subcommittee recommendation notes, currently in the self-directed services, once a person's hours of supports are identified in the person-centered plan, they can be allocated throughout the year according to the person's needs. This is not true for service allocation for people in the provider model of support. Next slide, please. The waiver subcommittee recommendation continued, notes that requests for hours are artificially inflated to meet the needs in months where needs may be the highest. For instance, if a person is in a pathway to employment, they may need 30 plus hours of CDS for the first 4 to 5 months, but then once they have found a job, their CDS hours can be decreased and their ongoing and follow-up supports increase. The current system forces a monthly request that is divided throughout the year rather than cumulative hours. The work group believes addressing this issue in LTSS system would result in less inflation of hours requested. So we did talk about meaningful day services and having that bucket of hours that could be utilized, but open it up for any additional discussions on this topic.
Well, I remember this topic coming up during the implementation of LTSS because it was a change from when the budgets were annual, when you could access the funding at any point in time throughout the year. And then it changed to a month to month. And I remember during some of those LTSS work groups, there were conversations around looking at that. But I'm curious, does LTSS have the capability of doing this? Is it something that the department is looking at? It is an equity issue between those two service models. And it would be good, I think, from the provider standpoint, to have that flexibility throughout the year across a number of services, because the way that you have to enter it now into the PCP, it's set for that month. And if you don't have funding or service authorization in that month, you can't receive that service. There was a question in there.
The department is not looking at annual allocation with one of your questions. This is just a recommendation that's come to us, so it's not something that we had in our planning discussions at this time. Other comments, discussion?
Is it a feasible option?
I don't know. We have to talk to Medicaid to see if that would be something from their perspective, and then we'd have to work with the system. Okay, we got Andy.
Do you need a motion from Rob to do that, Rhonda, or can DDA just do that?
To do what?
To look
Find
at
out if
feasibility.
it's feasible. Yeah.
Yeah, you can make a recommendation. Go ahead and make a motion.
I'll make the motion. I'd like, yeah.
Rob can make it? Okay.
Yeah, I'd like to make the motion that DDA explore the feasibility of moving to an annual maximum service allocation, just because I think it could help in a variety of ways. If plans are getting over allocated with hours, it could be then a challenge to maintain those budget numbers at a certain level. And they could be overinflated because we're trying to account for them disappearing at the end of the month.
Okay. Let's have some discussion so we make sure everybody gets all the thoughts and looks at it from different perspectives. Andy, your hand's still up?
Yeah, can I second that for discussion?
Okay. It's been second for discussion. It's open for discussion with the council for feasibility of going to an annual authorization.
One thing I would add is, if it's not feasible from a Medicaid perspective, then they should probably know that it is happening in some direction, because it's concerning to me that there might be this concept that Medicaid wouldn't allow an annual authorization, and yet we allow annual authorization for about 4,000 people. Just to know that the state's liability in the future if Medicaid were to look at that, if they ultimately told us that's a problem.
Okay. Any other discussion? All those in favor? Okay, any opposed? And we're really looking for actual council members to vote. Okay, any sustaining? Great. All right, so we'll take that back as a motion for DDA to look at the feasibility of annual allocations. Okay, let's go to the next slide. The next topic we received was related to budgeting and self-direction review. Can you have the next slide? The waiver subcommittee recommendation was that given the budget authorization exceeding the proposed $500,000 cap we recommend that DDA conduct a review of the current self-direction budgeting methodology. This should include assessing options for shared staffing models where appropriate, as well as exploring the creation of a self-directed service category for individuals who share staff. We recommend looking at New Directions waiver budget format as a model that offered equity and could meet the needs of people who choose to self-direct. So opening this one up for discussion.
Just for clarification, I think the New Directions waiver budget format, correct me if I'm wrong, but I think it was about the idea of authorizing people for services in a congregate setting. Like the old days, it would be like you get a group or you get a residential budget and then you can use that to self-direct rather than approving a whole bunch of one-to-one personal support hours. So it would like lower the budget.
Okay.
So, and then, yeah.
Okay, we have Andy.
I agree that we should look at this and go take another look at how budgets were based back when we had the New Directions waiver, but also look at what flexibilities people could have, because I think the system has gotten so overburdened and it's really hard for people to self-direct, without needing a lot of administrative support. And so I think as we're looking at basing a budget on a congregate rate, we also look at what system flexibilities people can have to try to reduce the burden that they currently have.
Okay.
So I think in our discussion in the subcommittee was also like looking at the idea of a separate waiver possibly, that the complexity that has come along the past 5 years with self-direction, it just keeps getting more and more complex, more and more rules. You're increasing the administrative burden on everybody involved, CCSs, support workers, family members, participants, DDA, that has to be driving up costs because you have all these forms and you have all these processes and then with usually the answer being no. So a perfect example for that, and something I have to bring up today that did not get in these recommendations, I don't know how it got missed because Charlotte has made sure it has been addressed in every one of our subcommittees, is the day-to-day administrator. That is something that it's in law, and it has been so watered down to they're allowed to get snow shovel and mow in your yard. I mean, those are like the services that you can utilize that for. The decision tree process got so just butchered. That was not the intent of the decision tree process, was for the team to make those decisions on who on the team could be doing those things. Instead, it was kind of decided for everybody, and now you do the decision tree to decide, do you need someone to mow your yard or shovel? So we really need that too. We've been asking for that. We brought it up at these meetings the last 2 times. People are in the planning process right now, and there are people, it should be part of the rate. It's part of the brick. It's an administrative fee. It needs to come back under IFDGS. And I think it needs to be an amendment that goes forward for July, that the day-to-day administrative position be restored to what it's supposed to be. And that to me kind of, that's crucial. Like that should have been in our work group, our subcommittee notes. That should have been in our recommendations. I believe Charlotte's gonna talk a little bit on it. But that's crucial for sustainability within self-direction. People are not going to be able long-term to continue to self-direct with all these complexities if they don't have that administrative support. You would never ask somebody in a group home, you would never have a group home without a house lead, a manager, making sure that all the processes are happening. And it needs to be addressed like immediately so that we can make sure that we get this in the amendments.
Charlotte?
Yes, to kind of go off of what Stephanie has pointed out, day-to-day admin has been a very important part of self-direction, and I think the proposed reductions, when they do start going through, is going to start making self-direction unfeasible and not workable. I think that for this waiver to function as it's intended, which is to encourage community engagement and choice in how services are carried out, we need to allow for a more flexible idea of what adults with disabilities, what participants could need. And right now, even just with what we have going on with the snowstorms and things like that, 10 hours a month is not going to sustain that. If issues like emergency or extreme situations can't be handled under what DDA is offering for the day-to-day services, then we have to review that again and go back to that because it is one of the biggest concerns with participants in self-direction.
Thank you.
On top of the other cuts, such as the reasonable and customary wages. Between those two, the cuts to day-to-day admin and the cuts to reasonable and customary wages will most likely have the most harm and disruption to participants in self-direction.
Thank you, Charlotte. Matt.
Just last year, I think the recommendation from the work group was that, I mean, sort of, this essentially eliminated day-to-day administration. So given the choice of eliminating it, given the rate at which it was increasing, I think the work group recommended some limitations on allowing family to do it because the majority of the increase was family becoming day-to-day administrators for parents, essentially parents of participants who lived under their care, rather than the committee, I think, decided to try to preserve the service for people who live on their own and have a non-family member day-to-day administrator. In order to do that, the recommendation would potentially be to limit it for family members. So that was, I think, the recommendation last year, and I think we would still probably recommend that, given what's happening to it, it doesn't become unfeasible.
Are you making a formal motion? Or are you just decide make your
I want to clarify, just getting my memory straight, because I think that was.
Can I make a motion that we take it back to the subcommittee and we come forward with a recommendation quickly, so that there could be an amendment, and I'm assuming this would just take an amendment to change it back.
So I would say a couple of things. I don't think we need to make motions to take things back to the waiver recommendation subcommittee. I think that subcommittee can meet and discuss and those types of things. So I wasn't sure if Matt was making another formal recommendation to relate to the family members and them being day-to-day administrators. So that's why I was asking, but it can absolutely go back to the waiver recommendation work group. Any additional discussion about this topic? Included a number of things.
I just wanted to clarify on the 24, on the shared staffing. The conversation with that especially was the easiest place for that to happen, and the place that makes the most sense was individuals receiving 24/7. So if, Johnny lives in an apartment and, he's sharing an apartment with one or two other guys, right, and they're in self-direction, they could potentially all have staffing around the clock. And that could be happening, like that could be happening now with people. So we need to look at that and, what would be the way that could be shared, right? And so, and I don't, that would probably require like Matt's knowledge of how that would work, of like, how you would have 3 individuals that self-direct with 1 staff member overnight. I don't know that, exactly how to make that work, but that's where I think there could be a lot of cost savings. if we looked at that. And I think it was really intended for that 24/7.
Do you have a sense of how many people are in that situation? How many people are living together?
I don't.
That are self-directing?
I'm just thinking it could happen, right? Like I could put in my plan and say that, I really need support overnight. I could get it. I could move in with somebody else also that has that. And that really could be a rest. So rather than really not allowing overnight when individuals need it, it could be, looking at long-term sustainability of individuals in the community. That could be a real way to help people really live in the community, live as independent as possible, but still self-directed services.
I think part of the discussion was if there was going to be a change in the budget methodology. So if we were going to say the award is based on, community living through phone and a certain number of people, to maximize budget for people who self-directed, that might not buy you 24/7 one-on-one support. If that's what the person's need, that they could look at continuing to self-direct, but moving into it, like sharing hours. So, and I would imagine it could be as simple as just amending the personal supports definition to say something effective. People in self-direction, are able to use this service or share this service with other people with self-direction or something like that. Just because it's always just an inherently one-to-one model, but it's not even necessarily specified. I don't think in the waiver that it's like this is a one-to-one service. It's just assumed that that's the case. So I don't know if you're the expert, but like why do we get amend the definition rather than trying to create new services and stuff like that that just sort of describe just the way we do with dedicated one-to-one hours shared for retirement during the day or whatever. It's just like language in there that allows it.
Yeah, I think that the things that would have to be kind of considered are other things related to that. So if the three of you are going to live together and you are all authorized the same amount, and then you're going to share, so you get $10, 10, 10, 10, but you're only paying $7, then what happens with the budget? Like, is it a different service with a rate that's a rate for 1 to 3, a 1 to 4, versus are we authorizing everybody gets a fully budget, and then you guys are getting a cost savings because you're putting your money in and not have to pay for the full amount, you're only paying for a part amount. So those are some of the things you have to think about in addition to adjusting the services. So like, what would be the rates? How would it work? How would people be authorized? Those type of things could definitely be explored.
And I think long-term, like I know a lot of the families I talk to, when I first meet with families, I say, what are your long-term plans, right? Like, and so many families have the idea of, well, I'd love to purchase a home, right? Like, I don't, like I'm going to put all my retirement to purchase a home for my child. I'd love them to share it. Like, parents are being creative and have these ideas. And so what can we do within the models that we have, right, that would enable people to use the Medicaid funds as fiscally responsibly as possible, and then still able to like give their loved ones that long-term future, right? So I think like if we could start to be a little creative outside of the box, maybe that we could, I think that's something we really should look at. I think it would bring cost savings. I think it would bring stability. It would be a great thing to look at.
Any other discussion? We go to the next topic. So then we also had through the council's content form. Remember, we put that out in our emails if you would like to submit a agenda item. We did receive a request to put provider training attestation on the agenda. So I'm going to ask Nova to come up and share information about the provider training attestation. We're just projecting into the.
Okay, do you have a copy to pull up?
No.
Okay. Well, I think it went out to the members, so you should have a copy of that training attestation. In our quality improvement strategy.
And project a little bit more.
In our quality improvement strategies in the waiver, there is a section that talks about the quarterly training attestation that providers must submit to DBA. So we developed a form, which I believe we shared with your membership, and then there's a Google form that providers can enter that information into. So what we wanted to do today was get your feedback on that form, and so we could, make any updates, edits, and incorporate that so that it would work for providers. Unfortunately, I don't have the form front of me. Do you all have it in the agenda? Okay. Yeah, and so what it says is that, you know, as a provider, I test that all my staff was trained on the date of service for the last quarter, and then you would submit that quarterly. Pretty straightforward, but we wanted to get your feedback on what works, what doesn't work, what concerns are, how we could enhance that.
Well, I think to start, there's still some questions around the training policy. And I had brought this up previously around MANT training. And then recently, I think I emailed you about this, but MANT is now completely gone from policy stat. And what's in there now is this term, I think, other approved DDA training, which is kind of ambiguous and doesn't provide a whole lot of information to the provider as to what are the true requirements here. Additionally, as it pertains to employment services, there's a lot of ambiguity around what is required there, aside from, say, the CDSP for job development. But because the provider matrix says that a lot of these trainings go into effect on July 1st, 2024, but then there was some information from the department that came out that delayed that, and so those things are still included as requirements, but there's not been any additional follow-up from the DDA about that. I'm sure that those are just a couple of the items. I see some hands up. I'll let others talk on it as well.
We got Laura.
Thanks, Rhonda. And I completely agree with Rob's comments. Andy and I had raised some concerns, and we did just send back some comments, Nova, today, so we know it was not in time for this meeting. But we were concerned about differences in the, you know, some of what Rob said, as well as, you know, issues between the training matrix, what's in the training matrix, things that are on the training matrix that aren't fully implemented yet, but still appear there, like the employment trainings, maybe some discrepancies, all the issues around the MANT training. So we did want, the other big issue is it didn't give providers an opportunity to explain if they didn't fully meet it 100%, and life isn't perfect. So there are times when something is not met 100%. There was no opportunity to disclose that. And in fact, some providers were told by regional staff that they absolutely had to just sign it and submit it. So we did submit some feedback that's pretty simple, but that clarify some of the language around what people are attesting to, ties it to the, I think we tied it to the training matrix. I'm sorry, I'm looking back to see what we suggested. And then, yes, we tied it to the training matrix. Our suggestion was try it to the training matrix, but make sure that the training matrix is actually completely up to date, as well as any requirements for the behavior support plan, nursing care plan, et cetera. And then give providers an opportunity to say, I am unable to attest to the above statement for the following reasons, include the number of staff, number and percentage of staff who meet the standards and timelines, and then the number and percentage of staff who don't meet the standards and timelines, and what their plan is to achieve compliance. Yeah, so those were our recommendations. I also say, so that's that. And then a question about how you all count the 80, is 86% is compliance, right? Rhonda?
So from what Laura's talking about from a federal perspective, currently the federal assurances, their performance measures, and from the current standards that they have, that's been in place for some time, is in order to be considered compliant and meeting that assurance, that the performance needs to be 86% or higher. If you're below that, then we would be considered non-compliant.
So can a question that has come up from a number of people to us is, how do you calculate 86%? Is it 86% of providers? Is it 86% of sampled staff? Or yeah, how do you get to that calculation?
Yes, my understanding is providers. 86% of the providers that are audited, whether their staff met the qualifications.
Okay. Because that seems, that has, if you had a number of providers that, had one or two people of all staff, you'd really be in a bigger much bigger compliance than that from a staff perspective. So it could be a little misleading. I don't know how you'd get to it in terms of counting all staff, but anyway, helpful to know.
Right. The federal assurance really is that the state can be audited, and when they get audited by the federal government, they're going to look to see that the staff meet the training qualifications on the date of service delivery. And so what we share in the waiver and in guidance is really staff need to be fully trained and qualified as per the waiver prior to services, so that when the day that they do the services, that they meet all those qualifications, and then ongoing. Because I could have simple things like CPR, first aid, I've got it today, but it expires next week and I have a gap for a month. We could get audited as a state overall, and we would have to return that money because that person would not have been meeting the qualification as a qualified provider.
So the other thing is, I think in the original form, one of the pieces of feedback we had was that it could be that just exactly what you said, Rhonda, that somebody, let's say they fall out of their, I don't know, their CPR is out of date or whatever it is, a training is out of date, and the provider doesn't have them actually working. They don't let them work, but the form, the way it was originally written, it was just like, are your staff trained or not, as opposed to for any time that you are billing for a service, are all of those staff. So that additional clarity would be helpful as well.
Yeah, so just to make sure I understood, Laura, you're suggesting that maybe the form be adjusted to note that the attestation or whatever the information is going to be would be certifying that the staff were fully trained at time of delivery of service.
Yes, exactly. I don't think we put that exact language in what we sent to Nova earlier today, but I think just the way you said it, Rhonda, is a really good clarification.
Thank you, Laura. Andy?
Hi, thanks, Rhonda. First off, fully trained was one of the statements that was a little bit ambiguous, because is it if fully trained based on the training matrix requirements, or is it that you're saying everybody has everything? So we tried to clarify that too in our response. And I'm just wondering if this is going to be something that the Waiver Advisory Council is taking on. Should we share our original letter and our suggestions for changes with this group, or are you just trying to collect feedback from us and DDA will do the inside work?
What we're doing today is, I believe it may have been Rob that submitted this as an agenda item, so we put it on the agenda. Nova's here, said, share some feedback. I know you were sharing information, so Nova's taking that back. If anybody wants to share some additional information, that would be great. We can look at.
Yeah, no, that would be great. And I think another thing that we can do is I can share the training matrix. We have been working on it, especially with that mat leave. And we just had some crosswalk done, but I'd like to share that too with the group and get your feedback on that. And then that's critical as far as these training attestations, because we would only expect people to be trained at the time of service delivery, so we can make that clarification too. I think that's a good one.
I think that helps to clarify what providers are actually attested to.
Right.
Can we also get clarification on what is expected on the self-directed side? So say, for example, a behavioral support provider, you know, if man is required, is it required for them, and then, you know, their staff under them, and then the direct support staff provide, you know, like, if it's not necessary in that case, is it a case by case? There's been a lot of chatter, like, on social media this week, people just panicking, I guess, at something they saw that came out. So maybe clarification, and I also think there's confusion with the new language, with some of the changes this year. Everybody is a Medicaid provider, so then they hear that word provider in there, and so I think sometimes words get used in more than one way, and then there's a lot of confusion. So maybe some clarity on what's expected for each model.
Yeah, and I think that could be something we do in the training matrix, right? It sounds like there's some clarity that we're seeing that needs to happen. So again, I think I can take this back and share with their council the training matrix, so we can have that discussion next time. And if you have any suggestions in the meantime, so that we can bring it back for conversation and share them.
I just had two other things as it pertains to the provider attestation. Is there an expectation as to who from an agency is signing that? Because there were a lot of questions around that, whether it should be the CEO, should be a you know, human resources director. What is the expectation from DDA on that?
What would your suggestion be?
Well, as the CEO, I did not sign mine. I had my director of training sign it because she manages all of the you know, the training for the staff in my organization. I would say if there's flexibility there, then I would say whoever at the organization manages the you know, or the CEO. So.
I think there's flexibility. I think that we want to make sure that whoever's attesting to it has the authority to do that. But certainly we can write like clarification or guidance, but definitely specific suggestions would be great. As far as like, you know, instruction, you know, who's designated and so forth.
Okay. Okay, great. The only other thing I had is once we submit it, we get no confirmation that it's been submitted. And so if there's some way to get confirmation that it has been submitted and to include information also maybe about which quarter has been submitted on that as well.
Okay, yeah, we can look into that. That's kind of a system design. So, yeah.
All right, Emily, you had a question or a comment? Emily, did you want to share something?
Yes, sorry, I was on mute, but can you give me a quick definition of what provider training station is? I mean, attestation?
Yeah, so it's an attestation, and what that means is that a provider is basically saying that we confirm that at this date, our staff were trained to provide these services. So they're attesting to that information, or they're confirming that information.
Okay, so, thank you, Emily. So really great discussion today. So I wanted to share where we're at and what our options are as the council, because we've gotten through a lot of stuff. Next on our agenda, we were going to talk about quality enhancement efforts and improvement strategies. And so just to kind of give you a little idea about what that is, and then also to decide what we're going to do since it is 2:54. In our December meeting, our quality improvement organization, Liberty Healthcare, came and shared information. Ken's with us today, and he also was with us in December and shared some information about the national core indicators. And during that meeting, you may recall, we had a lot of good discussion about, hey, let's look at more data and bring that to the council so we can kind of discuss it. And we talked about different areas where we could look at based on some of the focus areas in the national core indicators, like choice and control and employment and things like that. So what we have today is Liberty here to share some information related to not only the national core indicators, which you see in the slides, but also some of the work that's being done under the Council for Quality Leadership. Okay, so we got several slides that we can go through that. We also still have on our agenda report outs from our subgroup. So people with lived experiences, we definitely want to make sure that we open that up and have that subgroup report out. The waiver recommendation work group submitted that, those list of items that we put on the agenda as per their suggestion for that. And then we wanted to open it up for some public comment. So that being said, Rhonda's here the rest of the day. I can stay as long as anybody wants to, but we might want to decide the order of the next steps, anything we wanted to move to the next meeting, and also to be respectful of public input.
I'd like to suggest that I really appreciate the follow-up data and that be a self-review by the council members, and that if there's any questions that we would come back with that so we can move to the experience group and their feedback.
We got some thumbs up here. Is that okay with the council members on the phone?
Yes.
Okay, great. Charlotte, turning it over to you for update for people with lived experiences. And Eric, if you want to go to that slide.
Yes, thank you. Well, so we have a couple of bigger points that we wanted to make sure that we brought up and maybe even put forth motions and recommendations. In terms of the basic accommodation levels for people with lived experiences who are on this council, we still feel that they're lacking in ensuring that the input from people with lived experiences is well informed and accurate. So that goes both ways. The information going to people with lived experience and vice versa, the feedback going back. We are finding that there are issues in these subgroups with knowing how to acquire accommodations. You know, we believed that any type of accommodations that we needed in any subgroup under the council would be available. And so we're kind of reaching this point where there's no official chain of command of who we go to. When we went to DDA about better accommodations for work groups, we were told that we had to speak with the work group leadership. And when we spoke with work group leadership, they told us we had to go to DDA. So I do believe something needs to happen so that there's an official response or protocol for the individuals that need those accommodations and who can accommodate them. That is the first point that we have on our update. I don't know if anyone wants to add to that first before I go on to the next one.
Is there any way you guys can mute the SMRO organizer? It keeps cutting Charlotte's voice out.
Okay, so we're gonna mute it. Charlotte, when we mute it, we will not unmute until you give us some type of signal that you're done, and then we'll unmute again so that we can come back on. Do you want to go to your next point?
Unless there's any other comments about that before I move on, then yes, I can move to the next point. Okay, so the next point that we want to make sure that we put forth either as a motion or a recommendation, but that any cuts that are proposed this year that would affect personal support put on hold until we find out the impact of the cuts that happened the year before. We are seeing more and more cuts while also showing an increase of spending in other ways, and we want to make sure that the cuts done to such a vulnerable population are absolutely necessary. And from what we've been seeing through our research and what we've read into, that we do not believe that these cuts are necessary, and in fact, extremely harmful to the day-to-day lives of people in both models of the waiver. And so it's a motion to put forth a recommendation that all cuts that would affect personal supports be paused and on hold um, until further information or other options are looked at. And including cost saving measures like reducing administrative redundancies and extra documentations or compliances things needed that kind of seem to get added on every year. And so that is our recommendation. We hope that we can move that forward as a motion.
So Charlotte, just to make sure I understand, you're putting forth a motion. It's got 3 components, I heard, that you are recommending a recommendation go to the DDA related to personal supports cuts be put on hold until last year cuts are realized or figured or reviewed. And you're also proposing a recommendation to decrease administrative redundancies and compliance requirements?
Correct.
Okay. Discussions?
I second that motion.
Okay, we're going to discuss first and see if anybody has anything they want to discuss, add, alter, and then we can do the second and vote. Any discussions on that motion? Okay, we heard a second. Are we ready to vote? Okay, all those council members in favor?
Aye.
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 Those opposed? And then non-voting members? I know we got 2 here. Okay, so I think the recommendation that would go to the DDA, and remember this is a recommendation, so we'll share this with the Deputy Secretary, is that any personal support cuts be put on hold until last year cuts are realized, to decrease administrative redundancies and decrease compliance requests. So we'll share that with the Deputy Secretary as a recommendation for consideration. After last year's cuts merged to recently. Right, realized, right, understood. Do you have anything else? Apparently someone else has got their mic open. If you could, thank you. Charlotte, is there anything else you wanted to add before we go open it up for public input?
No, that I think that along with everything else that has been said, in consideration with the recommendations from the other recommendation group, I think the lived experience group is trying to work more, closely with the recommendation group, and we hope that we can collaborate more moving forward.
I second that, Charlotte. This is Josh.
Okay, great. Well, thank you so much. So today we had a lot of great discussion. Just a reminder, any formal recommendations to go to the Deputy Secretary will need the motions in the second. So we heard a couple of those today that then were kind of adjusted to go back to the waiver recommendation work group. So we're looking forward to getting those, any formal recommendations from that. The one that did get moved forward was the one that Charlotte just shared. So we'll open it up for public comment. We have some people in the room, so if you would like to share some public comment, we'll limit it to kind of 1 question or comment up to 2 minutes, and then also take any online so that we can have that additional input that would be for the council. Did anybody in the room want to share public comment? Okay. Anybody online that would like to share comment? And Eric, if you could track the time for us, that would be great. So the first person we have is Ariel Doris. If you'd like to open your mic and share a comment with the council, that would be great. One comment, please, so we can have an opportunity for other people and we can come back to, if we don't have a lot, up to 2 minutes. Just as our mic won't open. There she is. Okay, your mic's open.
Thank you. This is Ariel. I just wanted to thank this waiver committee. You guys made such really good constructive recommendations and it was put together so well. Thank you, thank you, thank you for doing this. I have a question and by all means tell me if this is not the forum for it. It is for the LTSS committee or the LTSS group in DDA. It's tangentially related to the time it takes DDA to approve PCPs. When the approval for a PCP takes more than 3 or even 4 months, and the approval for that PCP comes in after the beginning of the fiscal year, LTSS automatically truncates the DSA so that there are fewer than 12 months of services in the DSA. And it's brought us a world of problems in terms of getting the approved budget on the DSA processed into payroll. So I guess the question is there any way to work with that sort of, I don't know if it's a bug in LTSS, but not having 12 months on a DSA has created problems in other parts of the system with the FMCSs.
Yeah, thank you so much for your comment. I would just say that depending on the situation, if it was an auto extend plan, once that plan gets authorized, the auto extend time frame would have passed, and so then you've got this new kind of shorter 12-month time frame. Please reach out to the regional office and we can kind of look at your individual situation and see if we can help to support that. Thank you so much for joining us today. We're going to open up Ashley and then Tracy. Just remember, if you could share a comment, that would be great so that we can get to some additional individuals. You have up to 2 minutes. Ashley, your mic is open.
Okay, thank you. Can you guys hear me okay?
Yes, we can.
Okay, just a really quick question. For the self-directed services, if the service provider has is experiencing ongoing difficulty with the responsiveness from the FMS and they've submitted multiple support tickets and haven't gotten a response or assistance, who do they need to reach out to at that point for further support or escalation?
Yep, thank you for that question. Wesley Hunneman is the Administrator Director at DDA who is currently overseeing the financial management counseling services providers. And so if you want to contact any of the DDA regional offices, we can, or DDA headquarters directly, we can get you in contact with him. Thank you so much for sharing. Next, we have Tracy and then Jessica. Tracy, your mic's open. Tracy? Go ahead and share your comment, please. Thank you for coming today.
Yes, can you hear me?
Yes, we can.
Okay, great. Thank you so much for calling on me. I am a parent of a 30-year-old young man who self-directs, and my follow-up comment is regard to Charlotte's. I also agree that it is imperative that the administration consider pausing the proposed cuts to DDA's budget, and really looking at, let's pause and look at the actual numbers once this fiscal year ends, because we don't have that information yet. And this community has already struggled with last year's cuts in losing staff and a reduction in wages without any COLA increases for the past almost 3 years. My concern with proposed wage cuts is that we will absolutely be putting this entire waiver at risk for sustainability, but more importantly, risking the health and safety of participants. People will be harmed, and unfortunately, worse yet, people may die. And so I thank you so much for your time.
Thank you. Thank you for sharing your comment. Okay, we're going to open it up to Jessica. Okay, Jessica, can you share your comment with us, please?
Yeah, sorry, just got my mic unmuted. They got to me. I just wanted to add a comment because I was listening pretty intently on some of the timeline issues for PCPs, and I, don't know where to send this information, but I think it's helpful. That seems to be like a huge obstacle. Last year, my sister had 298 days between when she submitted her plan and when it was finally approved. And then this year we are on 171 days and still pending. And so my comments are for the group to consider that information, and to maybe also consider that she had responded to anything that her CCS had asked for and provided that in advance, and any email communication was responded to within 24 hours. So I'm wondering, what supports does the DDA have, or even at the regional offices, to help teams get this work done so that it doesn't only impact the participant, because she's the only one that really kind of suffers from people not doing the work or the absence of team members being a factor on her team. Because that 2 solid years and she's only got a few weeks of an approved plan. So I just wanted the group to kind of consider that. The timeliness, I hear everything DDA is saying, but oftentimes it falls on the other professionals, and it's still not workable for the person who's intended to get those services.
Great, thank you so much for sharing that. We appreciate your comment. And then we have Mimi. Hey, Mimi, if you can share your comment.
Sorry, I just got to unmute. So yeah, just a couple of quick comments. So the first is that, of course, a lot of people get their information directly from either DDA or the FNCSs to, build on that. The only one out of those currently that is in compliance with language access standards is GT Independence, who provides, documents and resources in different languages. So ensuring that, I know that, earlier you had mentioned, including the rights and responsibilities form in English and in Spanish, but ensuring that all of the information is available in different languages and formats. Again, we're talking about changes, to the waiver, changes to the manual, but there hasn't been a manual released in a different language since, I believe, 2023. So making sure that that is prioritized. The Actually, I would like to. That is my last comment. Thank you.
Thank you. Thank you for sharing. That's the last hand we have online. Anybody else in the room?
I had somebody text me during the meeting and say they've applied for the council and they keep getting an error when they apply, and so they wanted to know if there's some other methodology or could that be corrected, the application, I guess.
Sure. The application to be on the council is with the Secretary's Office Appointment Office. It's not handled through the DDA. You can contact our office. Nicole Cropfelder Williams is the one who helps to support that with the appointments office. So reach out to us and we're happy to look at that. Well, I want to thank everybody who was able to join us today and council members for staying over. Really great discussion. We look forward to additional recommendations. Would love to coordinate with the waiver recommendation subgroup to maybe join you to have some of those discussions. So if you want to let us know about those times, I know Nova and I would welcome that opportunity. Wish everybody a great day, safe travels. It looks like it's getting a little bit foggy out there, so be careful going home. Thank you, and we'll see you guys for our next meeting, which will be in April. Take care.
Thank you, everyone.